Okay, we will get back to your calls in just a moment, but we've had a very distinguished guest scheduled for some time, the Brigadier General retired William Bester. He is the senior advisor of the Veterans Healthcare Program and has a long and distinguished record serving our country. He's very concerned about a critical nursing shortage in the specialized field of veterans healthcare all across the country. We've got more and more troops being withdrawn, of course, from Afghanistan through 2014, and the need is only going to continue to grow. And he's working with the Jonas Center for Nursing Excellence, which is a New York-based nonprofit, which recently launched the Jonas Veterans Healthcare Program, an initiative that is dedicated to improving the lives of our veterans by delivering some of this care with nurses who understand the special needs of those returning. I thank you for being with us today here on WATR.
Larry, thank you for having me.
So how critical a need is this that we're finding in this country today?
Well, I think it's very critical. I think that, as we bring back our veterans from overseas, and, of course, we've got a lot of American heroes that are returning with physical, emotional, and psychological injuries. We look at, I think what's gone on over the last decade. We made some great strides in a lot of areas. Use prosthetics as an example. We've just done wonderful things in the area of prosthetics over the last decade to improve the quality of life for our servicemen and women coming back. And we've learned much and continue to learn much in other areas, but we realize that there's some areas that we still have a lot to learn, and a lot to learn really about how to treat the injuries that these servicemen and women are coming back with. And those kind of areas would be areas like PTSD and TBI and suicide prevention, to just name a few. So what Mr. and Mrs. Jonas decided to do was to work at this point in their lives at trying to help improve the health care through nursing and focused on our veterans' health care. And what they've decided to do is start up the Jonas Veterans Healthcare Program. They ran a quick pilot program out at the University of San Diego last year with 5 scholars, and that program went very well. This year they sent invitations out to 40 schools. They received over 100 applications from the 40 schools. They selected 54 new scholars that will be starting this fall from 33 different schools. Mm-hmm. And these scholars, each one of them, their studies will be focused on and trying to improve the health care needs of the veterans. So it's just a wonderful program, and it's a great opportunity for veterans to receive the benefits of this research and these changes in clinical practice. But also, Larry, it's a great opportunity for our veterans for career progression. A lot of the folks that we have in the Scholars Program are veterans themselves. In fact, in this new cohort that we just brought in, we've got 6 veterans, we've got 4 active duty folks, we've got 2 reservists, and about half of the folks that we selected for this group work at the VA, and 3 additional ones work within the Department of Defense. So it's a wonderful, wonderful program sponsored by the Jonas family.
Well, it is, but I guess the question that a lot of people might have on their minds when they hear this, we hear the president and others, of course, our congressmen and senators, saying that our first obligation is to make certain that federal funding is there for all the specialized needs of those who have put themselves in harm's way, come back wounded, injured, and with critical needs that may kind of defy our conventional understanding of what they've been through. Why is it that federal funding is not fully involved in this, that a nonprofit organization has come forward in this way? Are we not honoring what it is we hear our politicians say?
No, I don't think that's it at all. In fact, I think the government has done a wonderful job at funding studies related to the health care needs of the veterans. Last time I looked, in one area there had 350 different studies going on. But as we all know, the government can't do it all. Mm-hmm. And the fact that I think that probably all of us Americans, after spending 32 years in the Army, I think all Americans really feel like they need to be engaged, or should feel like they need to be engaged in some way. And I think that if you can have organizations supporting what the government is already doing, if we look back in time, a lot of the things that we learn for the military services, a lot of it is done, a lot of those studies and research are done by the government. Mm-hmm. But in addition to that, we get a lot of studies, and we learn a lot that come out of academia in the professional societies. And that's where Mr. and Mrs. Jonas are focused here, is supporting the profession of nursing in doing research focused on healthcare needs that can supplement and assist in all those different studies and programs that are going on already in the government.
Okay, I understand now where this complementary nature exists. According to this RAND study that was done in '08, 37% of mental health professionals felt unprepared to help veterans with all of the issues surrounding reintegrating into our society. And we're learning, of course, that, a U.S. vet from Iraq or Afghanistan is attempting suicide every 80 minutes. I mean, these are pretty dramatic, studies and immediate needs. How are we trying to address them? I mean, is this almost an overwhelming situation, or do you think in combination the federal government and, say, the Jonas Center and others are going to be able to tackle this effectively?
Right. In fact, I think we will be able to tackle it. It'll take some time what we're going to need are more providers focused in the mental health arena. And certainly one of the focuses that we have at the Jonas Center is to support the education of mental health providers in advanced practice nursing arena, people like psych mental health nurse practitioners. And I know that the VA and the government is also working very hard at increasing the number of psychiatrists, psychologists, psychiatric mental health nurse practitioners to support the mental health needs of the returning veterans. And in addition to that, I think that it's important that we have people out in the communities because especially during this war, Larry, we've had a lot of Reserve and National Guard folks who go back to middle America, small-town America, and will need support in their communities or at the local veterans facilities there. And the more we can do to educate mental health providers in the nursing arena, in our case, that can provide services to these veterans, the better off the veterans will be.
Absolutely, and we know that. I mean, so many people coming back, and of course it's a difficult time to be coming back in this recessionary environment. What do you say to somebody listening who says, I hear what's going on, I'm sure there's a lot of volunteer activities that I can participate in. What do you suggest that they do to help one of these vets coming back as just a regular citizen, if you will?
Well, I know that we get calls daily, and they're certainly welcome to contact the Jonas Center to see how they can assist through our efforts. We can be reached on our website at jonascenter.org. Or in addition, if you just want to call the office in New York at 212-609-1583 or 1584, we'd be happy to talk with people to see if they're interested in assisting with the efforts that we have. And then I think there's a lot of volunteer organizations throughout communities throughout the United States that people could call and say, what can I do locally to help our local vets in any way that I can?
Okay. Well, I want to thank you again.